mostly around children, but touching also on adults as well. So I'm really pleased to have Heather with us today. So Heather, thanks for joining us. It's great to have you on the show.
I'm very
Just
happy to be
tell,
on here.
just tell us a little bit about yourself and what you do.
Okay, so I am a board certified behavior analyst. I specialize in working with kids, especially with kids with autism. I do speech and behavioral therapy.
Okay, that's brilliant. So let's just talk a little bit about what's going on in the States at the moment with the coronavirus. What's it like over there?
It's been so crazy. It's been crazy with everything, especially kids on the spectrum. Routines and stuff are so important. And I think everyone's at home right now and their routines are off. They're not getting speech therapy, OT therapy, any type of therapies, ABA therapies. I've heard a lot of telemedicine going on where you can do therapy from your computer and stuff like that. But I don't know exactly how that would work. It's hard enough, to be sitting in front of your computer and having a child engage. That can be very difficult. So I think everybody's routine, everything is a little bit chaotic right now. So um, what I like to suggest to parents, I specialize in working with kids, and during a time like this when it's very chaotic, putting together social stories to help the kids understand a little bit more. Obviously, not what's fully going on, but understand a little bit what's going on or what might be to expect during the day. Doing things like visual schedules. Once again, I think kids, those on the spectrum, everyone. I'm a great visual learner, and when I know what to expect and what's coming up next in the day, putting together visual schedules with your kids, those are super helpful and important as well.
So just touching on that about the social stories, how can the social stories help around children around the coronavirus at the moment?
I think just understanding maybe what to expect, whether, there are some things like, you are going out to the doctor still, like, so they're doing ones like a social story, going to the doctor and what to expect. Like, you're going to drive in the car, we're going to sit quietly, and we're going to show good waiting skills, or just even some stuff with siblings included in it and having the kid be involved with putting together a social story of some of the stuff that might be going on right now.
So how do you feel with parents in general and children with this new pandemic with this coronavirus? Anxieties must be high, frustrations must be high, going out shopping. How can parents cope with this, and how is it best to engage with your children around this pandemic?
Honestly, I think just trying to, you're with them, but it's a little bit chaotic because a lot of parents are working from home and doing stuff like that. And just try and be with them and try and establish a routine, a schedule. I love doing like sensory activities, especially for those on the spectrum. They might be getting overstimulated, frustrated because they don't have their new normal routine. So I love doing things like sensory bins and sensory activities that kids love doing and playing with. And I think that those can be very calming as well.
Yeah, great. So as we know with this pandemic, you know, it's just popped on my news feed from Sky News, which is quite interesting. I don't know how accurate this is, but it's from a correct news source here in the UK. Sky News was saying large quantities of vitamin C may help with the coronavirus.
I've definitely heard that. I'm gonna let Kristin. Kristin's the expert on all that and with nutrition, because yeah, nutrition is so important, and especially during this time because you're not able to get out and get as much exercise and fresh air as you might like to. I know that my kids are feeling like trapped inside. They're asking me all the time, "Can we go to the park? Can we do this?" And it's been a little bit crazy, but that's where Kristin is a whiz and an expert on that. So I'll let her intervene there, and then you can come back to me.
Yeah, so I'll just bring Kristin in. Thanks for joining us this afternoon, Kristin.
Can you hear?
Hi, I think I might be live right now. I think we're having some technical difficulties, but I'm just going to go ahead and introduce myself in case I am on. My name is Dr. Kristin Shay, and I am a doctor of chiropractic, and I have a background.
Hello?
Hello.
Hi, I can hear you now.
Oh, you can hear us now. Right. Sadly, we've lost Heather there.
Dr. Shay, is she off now?
Yeah, she's there. We'll try and bring her back in a second. Uh, just a few technical issues this end. So, could you tell us a bit more about the nutrition side and about what people should be doing around the coronavirus?
That's where I feel like Dr. Shay's especially great at the nutrition aspect. I kind of talk a little bit more about the speech and routines and behavioral stuff and things that, trying to get the kids outside, trying to put together, we're not emulating a full school day. Like I get a lot of parents, especially, I'm not sure in the UK if you guys are doing the distance learning where parents are kind of expected to be the teachers now. And I'm like, that's kind of unrealistic. And I'm like, do your best and whatever you can and try and do things that where the kids can get semi outdoors and getting some energy out and sensory activities and calming activities as well.
I think she may be back with us. Can you hear us? Right. Got you there, but I didn't see you come on screen for some reason. I'm not sure why. Haha, you're there. Can you hear us now? No? She's disappeared once again.
Oh, weird, I know.
Oh no.
I
Right.
see her.
I've got everybody on screen now, so I can see you all. But
Perfect.
can
Oh,
you
perfect.
can you hear me?
Yes, I
Oh,
can.
brilliant. Hooray, we've got everybody on
Yay!
screen. Oh, that's great. So, Kristin, just tell us a little bit about yourself and what you do.
I am a doctor of chiropractic, and my background and focus is on functional medicine. And also, I have a degree in exercise physiology. So, I guess you could kind of say overall wellness.
Okay, so just tell us a bit about how can exercise, because obviously lots of people at the moment are trapped indoors, isolated, can't go out.
Yes.
Children with autism, ADHD, Down syndrome, dyslexia, dyscalculia, or even have a learning disability must be so frustrated because
Yes.
they do their normal routines every day. What can be beneficial this type of pandemic we're going through? How can parents help their children?
So, dealing with exercise, the importance of exercise is that we get the circulation moving and we oxygenate the blood. So, all of our tissues need oxygen to operate. So, moving the body is pushing the blood around and getting the oxygen to all those critical tissues so that our body can work optimally and also be able to fight off things like viruses. So, playing a game indoors, I'm sure Heather has lots of ideas on different games to play. If it's a possibility, I would also recommend actually going outside to walk. If there's a possibility of going somewhere where you're not going to be around anyone, some sort of outdoor space, if you are able to. I know some places you're not able to. It's also very important to be able to get vitamin D. Vitamin D is produced by being out in the sunshine on your skin. We produce vitamin C on the skin, and vitamin D also plays a very critical role in our immune system.
And I was just saying to Heather, just it came up on my screen, just Sky News was saying that vitamin C, that they think there's some sort of research that vitamin C can help with the coronavirus. What's your thoughts on that?
Yeah, vitamin C is an absolutely important nutrient for our immune systems. It's considered an antioxidant, and so what it does is it helps your immune system be able to fight off infections. So, not just the coronavirus, but immune system in general. It's going to raise your ability to fight off infections, which includes viruses. So, I have read some information that has come out of China that I believe in some areas, they have been actually using vitamin C in the hospitals to treat patients.
So what do you think, not just people with autism, but, parents, carers, or the whole general public, what should they be taking as nutrition now, vitamin supplements? What should people be taking?
So, what food does for us is food is obviously the basis of what we want to do. We want to make sure that we get a varied diet because not just energy we take from food, we take the nutrients. And the nutrients are what makes our physiology or the processes of our body work the best that they possibly can. So, in order to try to get that from your diet, you need to eat a varied diet, meaning all different sorts of colors of foods, vegetables, fruits, fresh, better quality is going to give you a better array of nutrients. Now, that can be difficult depending on places you live, availability, uh, likes and dislikes. So, those nutritional gaps, because when we're not getting an arrayed diet, we are going to get a less of a broad spectrum of the nutrients that our bodies need. And so, what you're going to need to do is supplement somehow. And a supplement is going to go ahead and fill those nutritional gaps and make sure that you're getting all the nutrients that you need. So that is how we'd actually designed Simple Spectrum, is to fill those nutritional gaps for children with autism.
Okay, so what sort of, I know you mentioned the vitamins and the minerals and that. So when we've mentioned vitamin C, so what sort of vitamins or minerals or superfoods, let's call them, what should we be eating now because of this coronavirus?
Fruits, vegetables,
I need
uh,
to eat more fruit.
yes, every color possible. Fruit is your friend. I know it has been demonized in a way because people think, oh, it's too much sugar. I'm going to put on weight. But there are so many good things in fruit that actually help us to stay lean and to stay healthy and to keep our immune functions, our immune system as high as possible. So fruit is very important.
Yeah, because I was reading the other day, a researcher was saying that here in the UK at the moment, the government are saying in the United Kingdom that we need to go out and exercise at least once a day to build up our immunity. Because, God forbid, if any of us get this coronavirus, we need a good, strong immunity to fight off the infection. So there may be lots of parents out there, even children with autism, who are not getting the exercise. And if they can't get out into the local area, what sort of activities and exercise can they be doing in their own living room or in their garden? Some simple, could you recommend any simple exercises, or would it be like just jogging on the spot or running around the garden? Because children with autism get really bored, their attention span doesn't last very long. So can you recommend any strategies or techniques what they could be using right now?
Heather, would you like to take this or would you like me to?
Yeah, I'll take some. I love games. I love doing things like being outside playing bubbles, if they can do that, playing hokey pokey, red light, green light, just different games and activities that kind of get the kids' wiggles out and keep them moving. Anything that you can do, any of those types of games. I did with my daughters yesterday a scavenger hunt in the house. Just little activities that are fun and different that help break up the day because it's the very same stuff that we're doing every day.
So tell us a little bit about that scavenger activity. How does that work?
So we did two types of ones. One of them, we put together cards and like 5 different cards. And one of them was like, find a green leaf. We did indoor things as well because we didn't really want to go outside. So we did find bath soap. So then the kids had to run around the house and try and find the bath soap when we picked out that card. Different things, and then they had to go and find them. So
Well,
just something new and different, and to get them excited, engaged, and motivated, and something fun, that we can do together. Because during this time, you do tend to see a lot more behaviors, and it's stressful for everyone.
Yeah, sure. And how do you both feel? And obviously, a lot of people on the spectrum don't understand what this virus is. How would you, as parents, describe to your children about this virus? And because there's lots of anxieties, frustrations, not just around children and adults with autism. Parents themselves are quite anxious.
Yeah.
This is where it's really tough. I feel like every parent, it's a little bit different. My kids know, or my first grader knows a little bit that's going on, but she just thinks this is fun. We're not at school right now, unfortunately. So it's very hard for her to understand anything like that, and doesn't understand kind of the severity of something like this. So just, like letting her know that we're working as a family and doing schedules and working together, and that we have to stay inside, and kind of why we have to stay inside, and practicing things like washing hands. And we're doing those things as well, and practicing more stuff like that.
Yeah.
What would you say, Kristin or Dr. Shay?
Hello, Dr. Shay, can you still hear us?
Yes, I can.
All right, Dr. Shay, I'm not sure if you heard what Kristin just said then.
No, I wasn't
sorry.
able to hear Heather. Heather's
All
not
right.
coming through on my end.
All right. Okay. What I just wanted to touch on as well is I wanted to touch on about your expertise in you're a cryo practitioner.
Yes.
Yeah. So I've had cryo practitioner treatments before, and it's helped me as a person with autism, because I suffer from lots of back pain. I've got a condition you may have heard of it, kyphosis of the spine.
Yes.
So I've got Schumann's disease, so I get a lot of back pain when I'm sitting up, because I'm in that sort of L position. The only time I can relieve the pain is by lying down. So how would you explain to parents about cryo practitioners, and what treatments? Because when I had the treatment, it made me feel really relaxed. I was in so much pain, and my back was manipulated. Well, when I say manipulated, I'm probably not using the right terms there.
No, that's correct.
But my back was, I forgot what they call it now, but it was like really, really thuds. And I suffer from wry neck as well. I don't know if you've heard of wry neck.
Yes.
You may call it something different in the States, something beginning with T. It's where the neck goes stiff. And some days I can wake up where my neck is completely stiff and I can't even move my neck. So when I first heard about cryo practitioners about 7 years ago, I didn't even know they existed and what they did. So I went to my GP, and it was my GP who recommended me to go to a cryo practitioner. He said, "Kevin, I can't help you at all. I cannot fix your neck." So he recommended me to go see a cryo practitioner. I went to go see this lovely lady here in Staffordshire who does cryo practitioner treatments. And she said, "I can fix your neck for you." I was like, "Oh, what are you going to do?" And she laid me down on a couch, and she just got my neck. I said, "Oh no, don't break my neck. Whatever you do, don't break it." And she just got my neck and went really fast.
Yes.
And after, it felt like I honestly can say it felt like I had a new neck.
Yes, that is a common thing that people say. So the beauty with having different types of doctors or physicians is that there are different areas of the body or different systems that they focus in. And so chiropractic specifically focuses on the spine and the joints and the muscles that are attaching to them. And so when misalignment occurs, what it does is it puts pressure on the nervous system. And the nervous system is like the electrical in your house. So it's how everything works and comes on. So your nervous system needs to be functioning optimally. And so if something becomes out of line or stiff or your muscles tense, what we can do sometimes is it's called in chiropractic, manipulate a joint so that we can release some of the tension and bring the nervous system back into function. So we call it turning the lights back on, as the metaphor goes. There are other doctors in the States, at least, that do manipulations as well and work on the muscle. Naturopathic physicians do, and also doctor of osteopathy. I don't know if those physicians do that in the UK. But chiropractic physicians obviously are the ones that specifically focus in that region. And yeah, it can do wonders for your musculoskeletal system and bringing your nervous system back into function. Just that being aligned.
Yeah, as a person living with autism, I don't like being touched or, people putting hands on my body, but I was in so much pain and I just wanted the pain to go away. And
Yeah.
when she did it, the release, the tension, the relaxation of it, it just felt like I can fully mobilize my neck where I couldn't before.
One of the beautiful things about chiropractic is that so many different techniques and so many different ways of getting the job done have been developed. And so, if you don't like getting touched, there's different ways to maybe minimize that. Or if you don't want a larger manipulation, there's different ways where we can be very gentle. Actually, Heather knows about one of them. When I go ahead and I work on her neck, I will use a different method that is, I guess you would say, less invasive, or it's more gentle. It's more gentle and more easy. And there's different ways that we can approach misalignments or issues with the joints and the skeleton.
Yeah, it's like a kind of like a clicker, or for those with both my daughters have sensory processing disorder, and so she'll do something that kind of my girls have ear stuff as well, and equilibrium's off, and she'll do stuff where she's kind of pulling it more and manipulating it that way instead of that big crack, which is great, which I like, but it's harder for some as well to tolerate, especially in kids.
Yeah, as we were talking before about exercise, now how vital and important of exercise, releasing endorphins and serotonin, and just gearing the body up in these stressful times. I don't know if you heard it in the US. About 2 years ago, there was some research done. I think it came from the US actually, where it showed that people with autism involved in the sport of karate and judo, I don't know if you've heard of the research where they benefited from it so much, and some children and adults were getting like black belts in karate. Why do you think that is? Is it because because that exercise is routine, or is it because it's focused, where people are just focused on what they are doing?
Yeah, so I think that there's definitely several things involved there. There's definitely a social aspect and being around other youth. There's focus, there's discipline, and there's also learning how to control your body, which is very important.
Yeah, I think it was around about the control aspect of it.
Yeah.
Yeah. I also think that in a sport like that too, you're getting sensory input. So especially those on the spectrum like that sensory and that touch, and you're giving yourself that sensory input, which is really important.
For me, as a person to exercise, I love swimming, and I think a lot of people with autism love being in the water. I've got an identical twin brother who's non-verbal. He's severely autistic, and he loves being in the water. He can't swim, but he likes that sensory aspect of the water, the temperature of the water, the feel of the water, and things like that. So, as regards to other exercises, I know. What sort of equipment would you suggest to parents to purchase now to use in their garden? I know my twin years ago used to love jumping on a trampoline. He used to have a 12-foot trampoline in the kitchen and used to bounce up and down on this trampoline. So would you recommend equipment like that?
I love trampolines. I think they're great for sensory input. I also love swings. I think that's
he loves swing. He's got a swing. Where he's at now at the care home, he's got a swing, and he loves that sensory aspect of rocking backwards and forwards. And
exactly. Or we have actually at our house like a almost like a cocoon looking swing too that really hugs you. And I think that that's great as well. It hugs and squeezes. And if you can't afford stuff like that, just even remembering things like squeezes and hugs and that kind of stuff, sometimes that sensory input can help as well too.
Okay, so I know we've talked a lot today about exercise and nutrition and health. Is there anything else you'd like to share with us?
Chris or Dr. Shay, anything that you think?
Or can you recommend any websites or websites of yourselves where people can look for resources, information, around health, nutrition, and well-being?
Can you?
Heather, is there any that you?
Just remember that try and make as much routine as you can at home. I know it's difficult times. Like I said, are you familiar with this distance learning there? Are you guys doing that in the UK?
Yeah, a lot of children at the moment are not going to school, so they're all being, taught at home and doing, online courses. Yeah. I'm not sure what it's like. I know it's apparently it's quite bad in the States at the moment with the coronavirus. I heard on the news today that you guys have actually taken over Italy now. And I think President Trump said there's going to be around about 250,000 deaths in the US.
Yeah.
Here today, I think we had. Yesterday, we had about 500 people, 400 people who died of the coronavirus. And even for me as a person living with autism, we can't, and I don't know what it's like over in the US, but we can't go out. Well, we had to go out today and get what they call a click and collect shopping. We can't get food deliveries. My partner went out today and he said I didn't go in the supermarket, but he said all the food aisles were basically nothing on the food aisles, and it's getting really bad out here at the moment. So I'm not sure what it's like there in the States. How bad is it?
It's definitely, they're just taking, like if you go to the grocery store, a lot of grocery stores, there's lines of people to get in these grocery stores, like down the street, and they're 6 feet apart. Everyone has to stay because the grocery stores are getting fined thousands of dollars if people aren't in that social distancing, and they're sanitizing the grocery carts before you go in, and setting a limit as well. It's definitely a little bit crazy, but hoping that this really helps with the curve and stop this, because I know I've heard that we're the highest amount of cases now, so
it's really scary because we're in the 21st century and we always sort of see these things and and futuristic sci-fi films. We probably never think that would ever happen in our time life. I'm not sure what you guys think about that, and did it shock you when you first heard of it?
Oh, I was in shock. It is definitely something that you're never fully prepared, or you don't think that this is something. These are things that I actually just saw on Netflix trending is that movie Outbreak. Have you seen that movie?
Yeah.
I'm like, why would you want to watch that right now? This is not a time that I'd want to watch that. But people are very interested in that kind of stuff, and it's just not something that we know as much about. And I guess we thought that maybe we were more prepared for it,
Yeah.
I don't know. What are your thoughts, Dr. Shay?
What are your thoughts, Dr. Shay, on that?
I feel like it's very easy to be very removed from situations like this until you start seeing it in your neighborhood. And I'm not sure what our area, I don't think, has been very bad yet. When we go to the grocery stores here, they're restocking as best they can. Not everyone is wearing masks. A lot of people are wearing gloves. You hear about it in other places, like Ebola was kind of big for a while in Africa, and when SARS hit and whatever, but a lot of times, at least here, we don't see things like this, so it is shocking, and I think it's been very stressful for a lot of people. And when you go out to the grocery stores, you can kind of feel the tension in the air. And now that we've kind of been in this routine for a little while, I think it's mellowing out. But as always, obviously, we need to be smart and take precautions and think about other people.
Yeah. Exactly. I do think that we're seeing a lot more people like compassion and people that like, are caring for one another as well, which is, well, I guess one good thing that could come from it. So,
And it's great that we've got this technology, because, if we didn't have this technology today, then I think a lot of people would be really, really stuck.
exactly.
I'm videoing my parents all the time, and because we can't go out to parents, and I think it's the same like that over there. You can't visit your parents; you've got to stay isolated. And a lot of people who are on the spectrum have got other underlying health conditions, so they've got to be. And here in the UK, they've got to be completely isolated for 12 weeks. So they can't go out for 12 weeks, and can't even exercise, because the most vulnerable ones are on sort of a lockdown.
Yeah.
So have you two got any websites you want to share, your own websites you want to share with us, so people can look?
Yeah. So one of the things that, being a BCBA, I'm really big about looking at the big picture as a whole and doing occupational therapy, speech therapy, everything behavioral therapy, but also looking at nutrition and possible nutrient deficits, as Dr. Shay was saying. So if you are looking for a good supplement, we don't try and push this during a time like this, but just a really good supplement, simplespectrum.com, simplespectrumsupplement.com, and we just created that to help fill nutritional gaps of our picky eaters, designed for anyone that might not be getting the best nutrition. I had touched on it a little bit, but my daughters have sensory processing disorder, and one of them has severe sensory and food issues and cyclic vomiting syndrome. So before even the coronavirus, we were always in the hospital, and now I'm actually terrified to go to the hospital because I don't want to pick up the coronavirus. But the good thing is they haven't seen as many cases. I don't know in the UK, but not as many cases with kids, at least.
Yeah, strangely enough, about 3 weeks ago, I had a blood test done here in the UK, and the nurse rang me back to say my potassium levels were low in my blood, and I thought, oh, that's strange, potassium. And I said, what do I do? And she just said, eat more bananas. So so I said to her, how many bananas should I be eating? And she said, well, I don't really know, and the doctor doesn't know, but you need to eat bananas to build your potassium. So what happens there then when people get low? What causes low level potassiums, and what's the cause of that?
There can be different causes of low potassium, different medical reasons, probably too many to get into, but obviously nutrition is one of the biggest ones. Just not having a varied diet. Potassium is common in a lot of different foods. It's hard to tell even what nutrients or what levels of nutrients are in food. So that's why we talk about having a varied diet and making sure you're eating different types of vegetables and different types of fruits, so that you get the amount of nutrients that you need from everything you eat.
So, Dr. Shay, what would you say where parents are really frustrated at the moment? Because we have lots of children who, children, teenagers, even adults who can't, some of their children used to be obsessed or are obsessed over things like, which not very good really, like McDonald's, and they obsessed with like KFC or chicken nuggets or French fries, and the children can't get hold of them. What sort of alternative foods could they take to sort of like that big switch? Because it's quite a big switch.
You can even try to recreate some of those foods at home, but in a more healthier way. So, say for French fries, for example, potatoes is a very healthy food. There's lots of different nutrients in it, and they provide so many different benefits. Actually, one of the biggest things in potatoes is an amino acid called lysine. And what lysine does in the body is it actually prevents viruses from replicating. So, it provides a very good function for your immune system. So what you can do is you can take potatoes and you can slice them up in the normal way. Take a healthy oil such as olive oil and just kind of brush the outsides of them, and you can bake them in the oven. So that's a great way to replicate it, and then you're not getting the bad fats that are typically added to the fries, because typically
like
at fast
the
food,
saturated fats.
yes, and the polyunsaturated, yes.
Okay.
Yes, so healthier versions.
And this is where actually I do a lot of food programs too, where you can set up opportunities for using pre-MAC principle, first this and then this, and trying new foods too, and touching new foods and playing with new foods, because a lot of things, it's harder for a child on the spectrum to try new foods and want to try new foods. So there's a lot of different ways that you can do that as well too.
Great. Well, thank you both for joining me today on the show. It's been a pleasure to have you both. You've got, really lots of useful information there. And I'm sure lots of parents, either watching this now or watching it on replay later, if they've got any questions, they can probably pop them in the comments box, and you can go on the feed and, leave them a comment, because there's lots of parents at the moment who are really frustrated, and lots of parents who've got children at home, and they basically tearing their hair out. So I think the information what you've shared today is quite beneficial, and it'll help a lot of parents, and not just the parents, the carers, children and adults with autism.
We're so happy to help. Thank you so much for having us on. You're an inspiration too.
Oh no, thank you for joining us, and have a great day, and take care, and most of all, stay safe.
You too. Stay
Thank
safe.
you so much.
Bye. Thanks.
Bye. Bye.
Bye.
Bye. Okay, that's all done. That's great. Thank you.